Zanidatamab is a bispecific HER2 antibody. That means binds to two domains on the HER2 protein, ECD2 and 4. And what that leads to is better receptor internalization, HER2 downregulation. So it potentially has a more effective mechanism of action. And how it compares to, traditionally after frontline chemotherapy in biliary tract cancers, we give something called FOLFOX, which is chemotherapy. So in the trial that we did, it did compare historically against historical controls. It compared compared well to that. So this trial was a global trial of 80 patients with HER2 2+ or 3+ biliary tract cancer. Zanidatamab was given IV once every 2 weeks. In the original study that we published last year, the overall response rate was 41.3% with a duration of response of 12.9 months. We have the updated results this year that we presented in ASCO. The overall response rate has remained 41.3 months, but the duration of response has increased to 14.9 months, and the overall survival, the median is 15.5 months. Now comparing that to FOLFOX, which was done in a different trial, so no cross-trial comparisons, but FOLFOX historically has had a response rate of 5%. So we did see, we think that HER2 targeting is the way forward in this disease. So majority of the adverse events on the trial were grade 1 and 2, very few were grade 3 and 4. The main side effect that we saw, which was mostly grade 1 and 2, was diarrhea, which was controlled with anti-diarrheal agents, hydration, so relatively, was relatively easy to control in our patient population. Optimistic results in the phase 2, so we are taking it that was in the refractory setting, that means after first line setting. So we are taking these results because they were promising into the first line setting, in which we are combining gemcitabine cisplatin and immunotherapy plus minus zanidatamab to see if that, to see the impact in HER2 positive cancers. Again, same HER2 2+ or 3+ and ISH positive, that's what we're looking at. Yes, so they need to be amplified, HER2 amplified, or IHC 2+ or 3+. If they are 2+, then they need to be ISH positive, which is in situ hybridization positive. But again, right now, this has been submitted to the FDA. The approval is not still out yet, so we'll have to wait for that.